Indiana Newsdesk is made possible in part by Smithville Fiber Internet, streaming TV, home security and automation in Southern Indiana. More information at smithville.com. Mallard Grodner Attorneys providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis. lawmg.com. IU Alumni Association connecting IU's network of alumni and sharing the Indiana spirit through scholarships, advocacy, and volunteerism. alumni.iu.edu. IU Center for Rural Engagement extending IU Bloomington resources to improve Hoosier lives in partnership with communities and organizations. rural.indiana.edu. And by WTIU members. Thank you.
Coming up on Indiana Newsdesk. The number of Hoosiers hospitalized with COVID-19 are at the highest level since April, but the governor says that's no reason to reinstate restrictions.
We're seeing COVID-19 spread in virtually every community, every county.
Illegal drug use and overdoses began skyrocketing during the pandemic, and what could come next has public health experts worried.
It does lead to concerns that you'll have, increased HIV or other IV drug use related infections and things like that.
Ahead, we visit rural southern Indiana, an area hit hard by the state's worst HIV epidemic 5 years ago, to see how the pandemic and lockdowns have affected the opioid epidemic. And a political expert joins us to talk about early voting, races to watch, and when we might get election results. Those stories, plus the latest news headlines from across the state, right now on Indiana Newsdesk. Welcome to Indiana Newsdesk. I'm Joe Wren. Well, more than half of the state's counties are designated as high-risk locations for coronavirus spread. 53 of Indiana's 92 counties were placed in orange or red levels yesterday under the State Department of Health's color-coded tracking map. The new numbers are the most since the state implemented the rating system in September. The governor says there is COVID spread in virtually every county, putting hospitals under tremendous pressure. As Pat Bean reports, more than 100 people a day are being admitted to Indiana hospitals with COVID-19 symptoms.
Across the state, nearly 1,700 Hoosiers are hospitalized with the virus, including nearly 500 in intensive care units. The South Central region has been hit particularly hard. Last week, the ICU unit at IU Health Bedford was full. That prompted IU Health to impose a stricter patient visitation policy.
We've been allowing one visitor, but that visitor could rotate. That is no longer the case because it poses too much of a risk to our patients, our team members, and our community.
Hospitalizations are at levels not seen since April, and small rural communities are being hit the hardest.
Most of the COVID hospitalizations were focused in the bigger, more populated areas, Indianapolis, Fort Wayne, et cetera. And this time, actually, Anderson, our hospital in Anderson and in Kokomo have just as many patients as our Indianapolis hospitals.
The Community Hospital Network, which includes 9 hospitals in central Indiana, is better equipped to deal with the spike in cases now than they were during the initial surge in April. They also have an adequate supply of personal protection equipment. Still, that doesn't mean their staff is immune.
Where we get a little bit anxious is staffing itself, is making sure our staff stay healthy. This week alone, we had 100 nurses out with COVID, 7 doctors. And so, it's real.
Hospitals around the state are coordinating their patient loads as the number of COVID patients continues to rise.
Perhaps there's some facilities that have more ICU beds, so especially in a rural area, they may have to transfer patients where there are more ICU beds available.
And with the flu season here, hospitals are bracing for another surge of patients.
People have called it the twindemic, or what could really be a double whammy.
The state's health commissioner says she's been told there could be a vaccine available for some Hoosiers by the middle of next month. Healthcare workers will be the first to get vaccinated with a likely limited drug supply.
We believe that the first vaccine that will come out will be Pfizer's vaccine, which is a 2-dose vaccine.
Bach says a second vaccine, developed by Moderna, could be ready by early December. Neither vaccine has been approved by the Food and Drug Administration. Republican Governor Eric Holcomb says he does not support requiring residents to get a COVID-19 vaccine, but he wants to make sure it is quickly made available statewide. For Indiana Newsdesk, I'm Pat Bean.
The state has recorded about 200 COVID deaths in the last week and added more than 18,000 positive cases to its total. The state's health commissioner says there are ongoing challenges with contact tracing that could be worsening the statewide spread of COVID-19. The state is seeing an uptick in people who are refusing to answer questions or comply with contact tracers.
We are seeing an increasing number of people who are just like, not going to help you, not going to give you information, not going to quarantine, not going to isolate. We're just not going to do it. I think they're tired of it. They're over it.
Meanwhile, the governor, who's up for re-election next week, doubled down on the importance of mask wearing, which he calls a small price to pay in order to bring COVID-19 case numbers down, as well as for keeping schools and businesses open. The U.S. government has agreed to purchase 300,000 doses of Eli Lilly's COVID-19 antibody treatment. It plans to pay $375 million. The government might purchase an additional 650,000 doses from the Indianapolis drug maker through June 2021. Patients who receive the medication won't have any out-of-pocket costs for the drug, but could have to pay a fee for its administration. Studies show the drug may have potential in treating mild to moderate COVID-19 patients. Well, in 2015, intravenous drug use in Scott and Clark County spurred the largest HIV outbreak in Indiana history. Vice President Mike Pence was governor then, and the situation attracted national media attention. Since then, medical officials have gotten the situation under control, but drug use has been a continuing issue. And as Mitch Legan reports, drug use skyrocketed when the pandemic hit and the state locked down.
For 4 years, Lisa's been attending recovery meetings at St. Paul's Episcopal Church in Jeffersonville. She'd hop in her car once a week and make the 30-minute drive to get there early, open up, and make coffee. But that all stopped in March after Governor Eric Holcomb issued a stay-at-home order, locking the state down to slow the spread of the coronavirus.
I was due to celebrate my 9 years. That Friday they called and said that everything was being shut down. And I was due to celebrate on Monday, and it really hit me hard, and I haven't been here since.
It's been a lot of work, but Lisa stayed sober through the pandemic. But for many others in the area, that hasn't been the case.
We're down about 40%, as far as overdose deaths and ER visits for overdose. And then once COVID hit, you saw that trend right back up again.
Overdose numbers in Clark County began skyrocketing when the governor locked down the state. By the end of April, overdose deaths were up 150% compared to last year.
January, February, March essentially mirrors 2019, and then all of a sudden you see it shoot up and stay up for 6 months or so now.
May saw the most overdoses since the county started keeping track of the data roughly a decade ago. And with about 2 months still left in 2020, the number of overdoses in Clark County has already surpassed last year's total.
If it was me and I was still in active addiction, and that was what I needed to make me okay, the pandemic would be an excellent justification for that. It would be an excellent reason. And so I'm not surprised, because that's kind of the way our minds work.
Counties across the state have reported overdose increases too. Indiana drug czar Doug Hunsinger says before the pandemic, Indiana was a success story. The state was seeing overdose deaths decrease by twice the national average.
We've seen a 79% increase in our opioid or overdose events at emergency departments. We've also seen a 63% increase in EMS naloxone administrations.
Lisa says many recovery groups, including her own, moved their meetings online at the start of the pandemic, and other options, including treatment centers, have been open.
Kind of made me more reliant on my friends and on my sponsor. I was always very reliant anyway on my sponsor, but very much more reliant. And just knowing that they're there, knowing that they're still clean.
Yezel will tell you that not having those personal connections and stability that come from group meetings, employment, and just regular life likely exacerbated feelings of isolation and hopelessness that were already on the rise because of COVID.
It's absolutely, an unintended consequence. And that's one thing I say is some of these public health decisions we make, we can't do them in a vacuum, because, my philosophy, at least, locally here, has been to kind of stay in the middle. If you're too aggressive, you're probably putting people at unnecessary risk. But if you're too conservative, the things you're trying to protect, some of that fallout outweighs what you're trying to protect in the first place.
The good news is that Clark's overdose numbers are beginning to level off a bit, and many groups have gotten back to holding smaller in-person meetings.
The big silver lining I take is the fact that even though our overdose activity has increased, our death rate has not increased as much, and so that tells us that some of our programs are effective.
One of those programs that stayed open was the county syringe exchange program. That's especially important because in 2015, neighboring Scott County was the epicenter of an HIV outbreak. Clark was also affected, and if drug use has gone up,
it does lead to concerns that you'll have, increased HIV or other IV drug use related infections and things like that are going to start popping up in, like you said, the next 6 to 12 months.
Clark County's Board of Commissioners voted to extend the county syringe exchange program in August. It's set to expire in July of 2022, the same time as the state's law that allows the programs to operate. Yezel says the exchange program is critical to keeping potential HIV cases down and hopes that when it's all said and done, this will be another example for state officials to see the effectiveness of syringe service programs.
COVID-19's effects on, the opioid epidemic, substance use disorder, it just shows how fragile this environment is. And, anything that kind of shakes the societal norms that we have, and you go right back to, to the 2016 numbers, and that's what we saw.
As for meetings at St. Paul's, Lisa says she's not sure when and if they'll start back up again.
I'll find out where the meetings are, if they're already going on, and I'll wear my mask and do what I got to do, because I don't want to have to live in that hell again.
For Indiana Newsdesk, I'm Mitch Legan.
Well, in honor of Children's Health Month, the Environmental Protection Agency has awarded Indiana more than $55 million to help reduce lead in drinking water. Now, most of the money will be awarded to local communities for things like replacing water and sewer lines, but the EPA will also give nearly $1 million to help test schools and daycare centers and replace lead fixtures.
Indiana has been a leader when it's come to statewide lead testing in our public schools.
Grant money to replace lead fixtures would also only go to schools and daycare centers that test above the federal action level of lead, 15 parts per billion. Among other things, children exposed to lead can have trouble learning, behavioral issues, and poor kidney function. According to the World Health Organization, there is no safe level of lead. Coming up next on Indiana Newsdesk. A highly partisan presidential election has led to political tensions along Main Street in Goshen, Indiana. Ahead, how the election is playing out in this Democratic town inside a Republican county. And the director of Indiana University's Civics Learning Center, Paul Helmke, joins us to talk about early voting, races to watch, and when to expect results from Tuesday's election. These stories and more right here on Indiana Newsdesk.
The WTIU WFIU news team connects Indiana to the world. We bring you the top news of the day on radio, TV, and online. We round up the stories that have people talking each week and dig deep into the issues that affect your community the most. The WTIU WFIU news team is where you are and telling your story.
Welcome to Amanpour on PBS. I'm Christiane Amanpour in London, giving you the global view. I've covered the world for nearly 3 decades, and I'm dedicated to bringing you all the facts. Please join me for conversations with newsmakers, world leaders.
Good to be with you, Christiane.
Artists and writers, the people who define, change, and challenge our world. That's Amanpour on PBS.
Welcome back to Indiana Newsdesk. Well, early voting continues through Monday. Long lines are a daily occurrence in Monroe County and across the state. According to the Secretary of State's office, more than 1.25 million Hoosiers have already cast their ballots. Now, if you still want to complete a mail-in ballot, you can, but you need to deliver it in person to make sure it arrives in time to be counted. Local polling places will be open for voters to cast their ballots in person from 6 a.m. until 6 p.m. on Tuesday, November 3rd. Governor Holcomb's election challengers came out swinging this week in their final debate before Tuesday's election. Democrat Dr. Woody Myers and Libertarian Donald Rainwater attacked Holcomb's record. Meyer's primary angle of attack was that Holcomb hasn't done enough to address the state's challenges, like with COVID-19.
We now have about 1,700 people in the hospital in the state, virtually a new record. There's a lot more to do, and right now we're not getting the response that we need from state government to get it done.
The candidates share their views on a wide range of topics, everything from marijuana legalization and redistricting reform to racial inequity and broadband access. Now, Rainwater says before casting their ballot, Hoosiers need to ask themselves, is the governor's leadership working for them?
You need to ask yourself as a Hoosier, am I getting better economically? Is what the governor is talking about helping me personally and my family?
Holcomb's strategy was simple: stay the course. He continues to tout what he calls record job commitments and infrastructure investment since he took office in 2017.
We have bounced back. Again, I just mentioned the 26,000 jobs that have come in this year, $4.9 billion in CapEx. Indiana remains the #1 manufacturing in the country per capita.
Holcomb has been able to keep up a front-runner campaign for a second four-year term with large advantages of name identification, fundraising, and organization over Myers and Rainwater. Well, this election is unlike any other. The pandemic has changed the way candidates are campaigning and the way people are voting. Paul Helmke is the former mayor of Fort Wayne, now leads IU Civic Leaders Center. He joins us now. Thank you very much for joining us. We just watched a story about this week's gubernatorial debate. I want to hear your thoughts on how the Libertarian candidate, Donald Rainwater, could affect this race.
Well, most people assume that Governor Holcomb is pretty far ahead. I think the biggest concern for Holcomb is whether Rainwater is going to take too many of his votes away. A number of people are apparently out there that don't like the mask encouragement that the governor has put down, so they've been pushing Rainwater. And of course, Woody Myers is saying that the governor hasn't done enough. So sometimes when you're in the middle like that, getting attacked by both sides, it weakens you. But I think the governor is going to be far ahead, but I'm sure he's concerned how much of the vote Rainwater is going to get here.
So why don't you think the Democrat here, Dr. Woody Myers, has done better?
Well, he still might do better on after Tuesday than we think. But he hasn't been able to raise the money. I think he's coming up with his first television ad today. It's his first time running for office, which puts you at a disadvantage in terms of name recognition. And but if Donald Trump runs a lot weaker and in Indiana than folks have anticipated, that could help Myers, particularly with Rainwater on the ballot, taking away some of Holcomb's votes too.
And as we said, people are voting early in numbers that we have never seen before. How do you think that's going to affect the results that we get on election night?
Nobody's sure. This is a different election. I've never seen anything like it. Obviously, COVID has made a big difference. I think President Trump's comments about questioning the validity of the election have spurred a lot of people to make sure they're out there early, getting their vote in person or by mail. But we don't know whether that means there's a lot of new voters or whether they're just people that usually vote that are voting early. I think we're going to see some new voters coming out this year, but it probably means that you're going to see more of the Democratic vote coming in early and perhaps Election Day being more of the Republican vote. So that could impact, at least in some areas, what the votes look like when they get tallied.
Let's talk about the polls in the presidential race. Race in 2016, we saw Hillary ahead in the polls. Biden is ahead now. Do you think polling will be more accurate this time around or not?
Well, first of all, the polling that people remember from 4 years ago was basically national polling, and it showed Hillary 3 to 4 points ahead. She ended up, in terms of national vote, actually winning by maybe 2 to 3 points. So the national polling was correct, but we don't really have a national election. We have individual state elections, District of Columbia election. It's the electoral count that is crucial. So we have to look at those states. And the big question here is, what states that Trump won 4 years ago is Biden likely to win this year? He can only give up 38 electoral votes. If Biden picks up 38 electoral votes from what Hillary got 4 years ago, then Biden wins.
All right, it'll be very interesting. Thank you very much for being here today. Appreciate it.
Good to talk to you.
More and more divisive as we move toward the November election, and that's playing out in the city of Goshen, Indiana, a little blue dot in a mostly red rural county. Indiana Public Broadcasting's Justin Hicks reports on how one block of Main Street has become a lightning rod for political tension and maybe even conversation.
Goshen's Main Street is a simple two-lane street, but it gets a lot of traffic. It's one of the most direct ways in and out of town. On one side of the street, there's a yard that's impossible to miss. It's festooned with colorful hand-painted signs that say things like, "Love immigrants, deport illegals," "Support ICE," Trump and American flags sway in the breeze. In the middle of it all, Lori Arnold sits on the sidewalk in a camping chair and waves at drivers.
I've been called cheeky before. I love that, because I am.
Arnold began demonstrating in June. She's had water thrown on her, her sign set on fire, and even suspects someone intentionally loosened the hubcaps on her truck. Every now and then, drivers slow down and yell at her.
Racist, homophobic, I mean, all of them. Yeah, I get called that all the time. The racist thing, especially, yeah. Which, like I'm not, how do you say I'm not racist? I'm not racist. But that's the perception that you get automatically.
Jeremy Stutzman, mayor of Goshen, says the situation feels representative of how divided politics in the country are right now. He wants to protect Arnold's right to demonstrate, but he's also worried her actions encourage politically motivated violence.
It's definitely escalating. It went from arguments to harassment to there's a battery charge, and now there's arson. So we have a growing concerns.
For a week in August, that block of Main Street was especially hard to ignore. Lupita Romo stood on the opposite sidewalk, countering Arnold's signs and flags with her own. She doesn't condone any of the violence towards Arnold, but as a DACA recipient, she understands the anger.
I was outraged. It almost hurt. I wasn't as hurt as I am now, but at first it was just anger, like pure anger. I didn't think that people here in Goshen felt that way.
Look at this though. I mean, like, they're protesting me with the Mexican flag.
Romo's friends joined her. They stood on the other side of the street for days, draped in Mexican and Salvadoran flags. It seemed Lori's side of the street and Romo's side of the street would never meet. But things changed a little one day. Lori was struggling to get the pole for an American flag into the ground. So Romo crossed over to help her out, and the two started talking, and kept talking for over an hour. Romo says to her surprise, the conversation was actually really pleasant. They actually agreed on a lot of things.
I could see a different side of Lori and not think that she was just crazy and like this racist lady, because I really don't. I want to say that she's not racist.
Arnold says she was never really interested in politics or protest before, but when she watched a video of George Floyd being killed by police, she had to do something. But she was equally disturbed by cable news footage of destructions from protests across the country.
I would have been out protesting, not rioting, but protesting police violence. But it just got taken over by a hijacked or whatever, by this Black Lives Matter. So instead of that, now I'm out protesting for the police.
Arnold says her signs are intentionally provocative. She wants strong reactions to force people to talk.
I know that I am being controversial maybe with the way I word things sometimes. There's a purpose to that, because what it does is, you may not like it, but it causes you to stop and talk to me about it. And that means that we're having a conversation. And I think that is worth pissing a couple people off.
But at least with Romo, the conversation didn't last. Arnold later posted a picture of Romo and her friends on Facebook, calling them goons.
And that's when I was like, you know what, this isn't going to work out. I'm just going to go off of what you're doing in public. There's nothing to really say or do about that.
The result of that conversation is unfortunate, says Leah Nemias. She puts together tough conversations for Indiana Humanities.
If you really want to have a conversation, I actually think you don't start with trying to provoke an emotional response.
Nemias thinks Arnold's in-your-face approach may be getting reactions, but probably isn't a good starting point for productive dialogue.
It is to get a reaction from somebody. And a reaction is not the same as a conversation.
Arnold says she's not sure how long she'll continue, but imagines she'll keep going until at least the November election. For Indiana Public Broadcasting, I'm Justin Hicks.
A former Trump administration official who penned a scathing anti-Trump op-ed and book under the pen name Anonymous is a former Hoosier and Indiana University grad. Miles Taylor is from LaPorte, Indiana, and earned a Bachelor of Arts in International Security Studies from Indiana University, where he was a Herman B. Wells Scholar. Taylor is a former Chief of Staff at the Department of Homeland Security. His anonymous essay was published in 2018 by the New York Times. In it, the person, who identified themselves only as a senior administration official, said they were part of a secret resistance force out to counter Trump's misguided impulses and undermine parts of his agenda. Well, after posting its first win over a top 10 team in 33 years, Indiana takes on Rutgers tomorrow. The Hoosiers opened the season last week by knocking off then number 8 Penn State in overtime. The Rutgers Scarlet Knights beat Michigan State. The win was Indiana's first over a top 10 team in 33 years, and it earned the university a national ranking. Rutgers' win snapped a 21-game losing streak in the conference dating to 2017. Now the two teams will be playing a game with a share of first place in the Big Ten East at stake. Kickoff is at 3:30 p.m. And that's the end of this program, but our work continues online as we cover the news throughout the week at WTIUnews.org. Have a great weekend.
Indiana Newsdesk is made possible in part by Smithville Fiber Internet, streaming TV, home security and automation in Southern Indiana. More information at smithville.com. Maller Grodner Attorneys, providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis. LawMG.com. IU Alumni Association, connecting IU's network of alumni and sharing the Indiana spirit through scholarships, advocacy, and volunteerism. Alumni.iu.edu. IU Center for Rural Engagement, extending IU Bloomington resources to improve Hoosier lives in partnership with communities and organizations. Rural.indiana.edu. And by WTIU members. Thank you.